Buffalo Bills safety Damar Hamlin remains in critical condition this hour after going into cardiac arrest following a tackle during Monday Night Football. Support's been pouring out for Hamlin from fans and fellow athletes. This morning we are getting expert insight into his injury and updates we should expect today. WWL-TV medical correspondent Dr. Corey Hebert is with us with more on Hamlin's injury. Thank you so much. I know you were on last night. We appreciate you coming back in this morning. Sure. What did you think of that? Because it just looked like a routine tackle. He was able to stand up and then just kind of collapse backwards. What are your initial thoughts seeing that?
Yeah, this is a tragedy. I mean, and let's be very clear here. This is something that doesn't happen a lot, but we learn about this in medical school. This commotio cordis is a possibility, and I want to stress this. No one knows right now exactly what happened because we are not in communication with his physicians.
Sure.
But I will say that from what it looked like, there's something called commotio cordis, and that's what a lot of the cardiologists out there are discussing, and ER doctors as well. Because what happens is it doesn't have to be a really hard hit. It basically is a hit that disrupts the mechanical action of the heart. And people don't really realize that the heart is like an electrical organ, right? It's electrical, which means just like a car, you have spark plugs, and those spark plugs fire off, and they have to fire off in the correct order at the right time for your car to run. Well, your heart's the exact same way. Your left ventricle has to pump appropriately so you can get oxygen to the brain and to the body. So if you, with commotio cordis, you get a hit to the left side of the chest, which is what he got. And then what happens is that the mechanical force distributes across the left ventricle, and then you go into a critical, horrible ventricular fibrillation. And when that happens, that means that your heart, your left ventricle cannot pump. When it can't pump, you can't get blood to the oxygenated blood to the brain, to the body, and that's what the biggest issue is here. Because they said that he did get a pulse on the field, but how long did he not have a pulse? They did CPR for 9 minutes. That's like you're not having enough blood to your brain and oxygen to your brain for 9 minutes, and that's why he's intubated now and sedated in the hospital.
Did you think it was weird that he was able to get up and then fall backwards? And then also, too, I mean, critical condition, is it weird that we haven't gotten an update yet? Well, what do you expect?
One thing we will say is that you generally don't get intubated. People were saying that that his vital signs were stable. You generally don't get intubated when your vital signs are stable, as well as when you are intubated and you are on medicines to make your heart pump appropriately, and you're on a ventilator making your lungs work appropriately. Things can't theoretically look that your vital signs are stable, but him standing up is something that you couldn't normally see with this condition. It's not a very common condition, but we've known about it for hundreds of years. Matter of fact, they used to have something in Asian fighting that was called touch of death, where you don't have to hit the person hard, but if you hit them just the right time with the right disruption of the cardiac rhythm, then you can actually have cardiac arrest. And like I said, I have to stress, we don't know exactly what happened.
Absolutely.
Because he could have had a structural cardiac abnormality that no one even knew at this time.
Even with all the
NFL testing. It's possible. So what we have to do, we have to say this is conjecture that we're talking about. We're speculating. But I will say that we have a lot of high-level people that are discussing this, and we do know it was cardiac arrest, and it wasn't like a cervical injury that you most of the time see on.
What do you expect the outcome to be?
I'm concerned about this young man because it's not necessarily about how his heart's going to be. What's going to happen is how long was he without oxygen. And that's why it was so important that you have to cardiovert this person immediately with an AED, which happened on the field, and CPR happened immediately, which perfuses the body because you're using your hands to perfuse the blood that is oxygenated in the body throughout the body and up to the heart. Up to the brain. So that's what this is about. And I'm just nervous about his outcome, long-term outcome.
Oh, gosh. We have less than a minute. I know you did want to talk about some new COVID variants. Can you squeeze that in for us?
Yeah, XBB 1.5 is out there right now, folks. And, there are 250 million cases of COVID-19, 250 million, I said that, in China in the last month.
Wow.
Okay, and right now it's about 40% of new infections across the U.S., but 75% infections across in the Northeast. So please wash up, mask up, separate, vaccinate. This is long from over. You do not want to get this because this new variant is not. We don't know if it is much more virulent than any of the others. What we do know is that if you get long COVID, you're going to have a problem. And I know we hadn't talked about this for a few weeks, trying to give you a little bit of a rest from it. However, this after our holidays, this is a very real thing, and we all know somebody right now that has COVID, and we all know people that are going to get long COVID at this point. So it's just a bad situation. Not a happy morning, but I pray for this young man's family.
Dr. Corey Hebert, thank you so very much.
Thank
All right,
you.
let's get back over to Peyton.